Good morning. Welcome back.
Thank you, Rob. Good to be here, as always. It is.
It is. It's wonderful to have you, Admiral.
I keep waiting for that other shoe to drop.
No shoe?
I'm sitting in anticipation. What is it going to say now?
No shoes. No shoes dropping. We're good. Always like having the Admiral here. Enjoy seeing his boat parked out in the parking lot all the time. Not a boat, Rob. It's a ship.
It's a ship. It's a ship.
Not a boat.
But still has sails.
What's the difference between a boat and a ship?
The simple definition was you can lift a boat up and put it on a ship. So it's okay. It's a size function.
Bigger, and the bigger boat has the right of way in the water.
Well, there's a lot of things that, that's not necessarily the case.
But ultimately it is, though, isn't it?
Yeah, it is, yeah.
Mike Allers Jr. is with us as well. Reformed school teacher, I guess you could say.
We were just talking about recovery, yeah.
He did it for a while and he had enough of it, right?
Yes.
6 years in the classroom?
That was enough, yeah. I mean, I do miss it a little bit, you know. I think that will always be there, but, you know, I want to advocate for them in a different way.
Yeah.
And get properly paid for doing that.
That's always a goal.
Yeah.
Mike works in Republican Party politics for what organization?
I do. Well, right now I'm working for Students for Life of America.
Mm-hmm.
And
I'm sorry, I missed that. What for America?
Students for Life of America. And I also work for, I do some consulting for Winning Republican Strategies.
Very good, sir.
Yeah.
Now, before we get to our guest here, Bill's going to close the door. Okay.
I thought Bill was going to walk out.
He's leaving it. Took his headsets off. Like, what is Bill doing? I've never seen that move before. Do you know how to sail, Bill?
Yeah, not well, no. But I have sailed.
You have sailed. My youngest son, he lives Fed Hill, Baltimore, and he's within walking distance of the water there. He took sailing lessons. I guess you pay for like 4 or 5 sailing lessons, and you can belong to some sailing club, which he did, and you can sign up to be parts of crews and go out on whatever.
How does he like living there?
He loves it.
Federal Hill?
Yeah. It's very much a young people area.
Okay.
Right? Very, very, dogs being walked all over the place and bars and restaurants everywhere that you look on every block. So it's a great area for young people. It's relatively safe. But anyway, took sailing lessons. He really loves sailing now, and he's signing up to be parts of crews and whatever. So I didn't know if everyone in the Navy has to take a lesson on sailing at some point in their lives, Bill, but he seems to enjoy it.
I don't think you have to take lessons, but many of us, most of us, we enjoy the water. We enjoy the water any way we can get to it, either big boats, small ships, or sailing vessels. So I've done quite a bit of sailing, but I don't consider myself to be an expert sailor.
Very good. Well, to the phones we go here, and our guest is from Americans for Prosperity, West Virginia chapter, Tyler Henry. Tyler, good morning. Thank you for being with us.
Good morning. Thanks for having me. On the topic of ships, they say there are good ships, there are bad ships, but the best ships are friendships.
Yes, indeed. I remember learning that when I was in grade school.
I like that.
Right? And I think that was on the Brady Bunch when I was a kid, too. Right?
That's certainly before my time, but
not mine.
I'll take your word for it.
Yeah, you'll have to. Yeah. How old are you there, Tyler?
I'll be 32 in November.
So you're in our co-host Mike Allers Jr.
Yeah. I'm 30. Yeah. I'm 33, but so I grew up on. I was weird. I grew up on Fox News and TV Land.
Yeah,
and additionally Cartoon Network. So that's where Brady Bunch. I watched the reruns.
Yeah. That was the same thing in my household. We flipped back and forth between the Glenn Beck program and All in the Family.
Oh yeah,
I love that.
Yeah. Archie had the best idea for stopping hijackings. You remember what that was?
I couldn't tell you what it was.
You pass out pieces to all of your passengers, and at the end of the flight, you pick them back up. That way, if you got a hijacker on the plane, they all pull out their piece that scares the hijacker.
Oh my gosh!
Yeah, that was one of the first episodes of All in the Family. It was classic stuff, right? Anyway, Tyler's the Deputy State Director of Americans for Prosperity, West Virginia. And Tyler, you guys are involved in an active campaign that's going door to door. What are you doing?
Yeah, we try and do a statewide campaign of door-to-door canvassing every year. Every year something a little different. We try and pick whatever the most contentious issue of the year is. And this past year, the failed vote to repeal Certificate of Need was the most contentious issue. And we're going to go out and do what we do best, which is door-to-door canvassing, trying to connect constituents with the votes of their lawmakers and explain to them why this is such an important issue. We're going to hit 100,000 doors statewide.
100,000. That's a goal.
Yep.
Yeah. How many people are going to be doing
we're going to hit it.
How many people are involved?
We're definitely going to hit it.
Yeah. How many people are involved in it?
Yeah, we've got, between our activists and paid staff, we've in the past reached upwards of 30 paid part-time staff, and then as many activists as we have on the issue. So that can range somewhere between, tens to upwards of 50. It kind of just depends on the area of the state. Some areas we have more activists in than others.
Mm-hmm. So certificate of need laws are very encompassing in the state of West Virginia, cover many things, and they're under a variety of names as well. But there are many things that are protected by certificate of need laws in West Virginia. What specific laws are you hoping to repeal? Are they mostly the medical ones?
We're trying to repeal the ones that affect the medical industry in the state, right? Things that the healthcare authority would have to approve. So those 44 certificates of need in the legislature this year, there was a vote in committee, as I'm sure many people are well aware at this point, that failed by one vote.
Wow.
There were 10 Republicans on that committee, and if you know anything about the West Virginia House of Delegates, it's 91 Republicans out of 100. Mm-hmm. So it is a super-duper majority, and those committees reflect that super-duper majority. So the handful of Democrats on the committee joined some of the more liberal Republicans on that committee to kill repealing certificate of need and prevented kind of a free market approach to healthcare in the state.
So we did a lot of interviews about this when it was during the legislative session, Tyler, and most of those interviews were obviously with Republicans because 91% of the elected officials in the House are Republicans, and that's about the same percentage in the Senate as well. And some of those Republicans who are very conservative on a lot of issues voted against certificate of need repeal because they were very concerned about their hospital in their lowly populated state not being able to compete in the marketplace. And while we did Americans for Prosperity interviews with you folks during that time, and your spokespeople and those from the Cardinal Institute said that's nonsense. We've found evidence in other states that these hospitals will not just compete, they'll actually do better. The elected officials in those counties did not agree, and that seemed to be the reason why they voted against repeal. What do you say to those people who are very concerned in small populated counties that their hospitals will go away?
Well, I mean, I would repeat what we've said before, right? Every certificate of need is not new. It's been around for many, many years. Every presidential administration since Reagan, Republican, Democrat, has come out and said we should get rid of certificate of need. It is getting in the way of improving quality, access, and lowering costs for healthcare. But part of what our door-to-door effort is, some of the arguments that we heard were, well, we were just representing our constituents. Well, we're going to go talk to those constituents and explain to them exactly what this is, because it's my suspicion that the constituents have no idea what certificate of need is, mostly because it's an incredibly complex issue. It's not like roads or taxes where it's something that directly affects them. This is really an indirect effect. But what we find is once people know what it is, they're incensed by it. They can't understand how the medical system works that way, and they're frankly offended that it still exists.
Tyler, because of the large number of people in West Virginia on PEIA and Medicaid, I've also been told that this makes West Virginia a bit different in regards to certificate of need because there just aren't that many payers along the way who are not PEIA or Medicaid, who are able to financially keep these hospitals in business because of the small amount of payment that they get back from Medicaid and PEIA.
Sure, and I would say that as we continue to improve the state's economic position, in the Eastern Panhandle, where you guys have seen, you've seen record influx of people, and that improves what's called the payer mix, right? The difference between the kind of government subsidized plans and commercial insurance. The growth that you guys have seen, certificate of need is getting in the way of hospitals having that, or not just hospitals, but other healthcare facilities, having that flexibility to meet the growing demand. So to answer your question, I think as we continue to grow, this is not just a problem that needed to be repealed 2-3 years ago. It's going to be something that is going to be increasingly important that we repeal as we continue to grow.
Bill Stubblefield.
Yeah, good morning, Tyler. Certificate of need, are you advocating carve-outs? Any carve-outs?
No, not at this time. And our rationale behind that is if one certificate of need is particularly egregious, they're all egregious. We should just do it wholesale all at once, because that's what we've seen works best in other states like South Carolina and Montana.
Well, it's been discussed a great deal on this radio show and other venues as well over the last several years, from not only the hospital but also from hospice. I'm on the hospice board, so I'm particularly sensitive to the hospice. We have seen in other states where there's certificate of needs been appealed, that the hospice has been cherry-picked. The long-term care, such as the cancer individuals, cancer patients, are being accepted and treated with hospice. Others less so, and you get in more rural parts of the Eastern Panhandle, and there's a great fear that hospice will not be there to support. I have not seen anything other than verbiage that would put my sense of concern at ease. Can you assure me that other sections of the Eastern Panhandle that would not lose the hospice facilities?
Yeah, I mean, I can't speak specifically to hospice itself. When we're looking at certificate of need, we're looking at all 44.
Excuse me a second. Excuse me. You just said you'd have no carve-outs, so by definition, you are speaking of hospice.
Well, that's my point, is what I'm getting to. It's like all 44 of those carve-outs. There is 50 years of research from compiled by the New Center for Regulatory Research at WVU that shows, part of that research shows, and I'd be happy to connect you with some of that research, is when we remove certificate of need, services in rural places increase. They don't decrease. So that's what I would say, is the research shows that the opposite is true, that access to care increases.
Let me pick up on going back to the hospital now, and then I'll turn it over to my colleague, Mike. You mentioned the hospital system in the Eastern Panhandle, and you implied that because of the certificate of need, we were not getting the health care that we deserve. But yet, there's been an investment of several $100 million in our local hospital, not only in the past few years, but also projected for the next 3 or 4 years. I've not heard a single person say they're not getting the medical care they're looking for, especially with the changes that are coming. What have you heard that I haven't heard?
Well, there is certainly. I have 2 examples. There is the Cardinal Institute put out a great video. And to be clear, what I'm saying is it's not growing at the same rate that the population is growing. So there is a lot of people who are going across the border. One of my employees could not find room to birth his child in West Virginia, and had to travel 40 minutes to Winchester to do it. Things like that. It's not necessarily the quality of care, it's the access to local care that is the problem.
Mike Gallers Jr.
Tyler, thank you for being on this morning. I could completely attest to that. So I live in Charlestown, but when my wife was pregnant, we had to go all the way to Frederick to have the baby, and it was just better care. When it comes to just doctor's visits, it's very hard to get an appointment on time. I would find it in the Eastern Panhandle, and even the quality of care, even going to Martinsburg. The doctors, it's completely different night and day. Like when you go to Maryland or Virginia, West Virginia is behind. The facilities are behind. The care doesn't seem as personalized or quality, frankly, as these competing states. Do you think that a part of this problem, I know you guys have been pushing for the repeal of these laws. It always seems to fail in the legislature. There always seems to be a reluctance. Is this something, and I know you have a good relationship with Governor Morrissey, that he could do via executive order?
Well, I think he's already started to do that, right? He's made several appointments to the Healthcare Authority, currently chaired by Robert Sharon, and I believe the kind of governing philosophy is to say yes. Right. But just saying yes isn't good enough. We have to repeal it because it repeals all of the fees and the administrative costs of even applying to get a certificate of need. And a major problem of certificate of need right now is the competitor's veto. Is the competitor can come in and say, you're going to take away business from me. I'm going to tie you up in court. And a facility that was supposed to open 3 years ago now has to pay all kinds of legal costs and legal fees, and that's 3 years where people aren't receiving the care that they need.
Do you also think that this is a way for WVU to keep their monopoly of certificate of need is not passed?
Those are your words, not mine.
Okay.
So I'm not going to comment on the business strategy of WVU Medicine or any other hospital or healthcare facility in the state. But I think you have correctly identified one of the potentialities of the current system of certificate of need.
Also, do you think that this would bring, because look, I'm sure you've seen in the Eastern Panhandle, we're getting a lot of homes. A lot of people are moving here. Do you think that the repeal of this law would help keep people here? Because it is ridiculous that I have to go across the border, not only for doctor's visits, but even in some cases affordable groceries. Like a lot of people in the Eastern Panhandle have to go over the border for everything. So how do we stop that in regards to not only healthcare, maybe education? Is this something that Americans for Prosperity is committed to doing to help keep people in West Virginia?
Yeah, I think that's right. Right. The more that you build in West Virginia, the more that it attracts to West Virginia. On the opposite side of the state, there was a hospital that wanted to build a $500 million brand new hospital in Wood County, West Virginia. They didn't even apply for the certificate of need because one of their consultants, worked it out and said, well, you're not going to get it. So they built it just over the river in Marietta, Ohio, where there are very few, if any, certificates of need. They didn't have that barrier to entry. So that $500 million investment went into a different state and attracted people to live in Ohio, not in West Virginia.
Tyler Henry, our guest here, Deputy State Director of Americans for Prosperity, West Virginia branch. Tyler, why not do a full sweep of certificate of need laws? Why are you concentrating strictly on health care here?
Well, I think healthcare is the one that is the most impactful. Right there, I'm aware that there are a bunch of, speaking of ships, there's some certificate of needs with like trolleying people to Blennerhassett Island, speaking of Wood County, but those are not really the big economic drivers, because remember, certificate of need is partially an economics question too, and that's what certificate of need asks for, is the economic viability of opening or expanding healthcare services. So it's just as much an economics question as it is a healthcare question. But some of these certificates of need are not nearly as impactful as healthcare is, right? We all need healthcare. We all need healthcare, right? At the end of the day, we all need healthcare. We don't all need a certificate of need for a ferry to Blennerhassett Island and back.
There's an old saying, Tyler, that if it's not broken, don't try to fix it. In your mind, our medical system, I think, appears to be broken. I see some real question marks for our health care in the state, especially in the more rural part. Rob alluded to it earlier. The big, beautiful bill is going to have impacts. We've been told that by the Republicans that the impacts can be managed. Hopefully they can be, but there's no real guarantee they're going to be managed. We're going to continue to keep the health care in the more rural areas. Coupled with the fact you just got through saying that hospice is not going to be really affected based upon your global surveys. I'm not convinced of that either. You may well be right, but we're taking a big chance with your door knocking, your 100,000 people door knocking. We're taking a big chance that something that is working now will continue to work. And I asked you a while ago for your sense of guarantee. You did not give me any comfort level. All you did was just invoke some of these nationwide surveys, nationwide studies. Do they apply to West Virginia? Maybe. Maybe not. I don't know. But anyway, my comfort level is nervous right now.
Sure. And to assuage that is, I would just look at the healthcare outcomes in South Carolina and Montana. Those are two of the states that most recently repealed their certificates of need, and healthcare outcomes improved in those states. I would just encourage you to look at that, and especially rural states like Montana, the onus of why they repealed their certificate of need was to increase access to mental health facilities in rural areas. They saw an increase in access to mental health facilities in rural areas after they repealed their certificates of need.
Real quick, Tyler.
1 minute left.
We're 1 minute. Do you think because we are 50th in healthcare that we have nothing to lose by going all in on this and repealing certificate of need?
Yeah, I don't think there's anything to lose on this. I think this is a winning. I think this is a winning strategy, and this is a winning policy position to repeal it.
Tyler, thanks so much for being with us this morning. Much appreciated.
Thanks, guys.
Thanks,
Have
Tyler.
a great day. That's
Thank you.
Tyler Henry, Deputy State Director, West Virginia branch of Americans for Prosperity.